University of Minnesota.
We'll leave that question
Energy
for future weeks. A viewer from Howick, this might be down the aisle that you were talking about just a minute ago, Representative. This viewer was concerned about mental health issues and wants to know what the legislature is likely to do this session about that. So let's start with you. We'll go around the table.
It comes up in more conversations, both in my office and in committees this year, and its relationship to housing. So there is a situation where a life has sort of spiraled out of control and is in the emergency room at the hospital. When they're ready to be discharged from the hospital, there is insufficient permanent supportive housing, those housing infrastructure bonds that you've been part of. And so where does that person go? And sometimes they're discharged to the street. Sometimes they end up at places that are much more costly. It's not like we're not spending money at the Anoka Hospital, or 50% of the people in the Hennepin County Jail are mentally ill. So a long time ago, we opened the doors of the institutions because we realized warehousing this population was a really terrible, terrible thing to do. But we never replaced it with a good comprehensive system. And so now all of the people in this population are having to try to figure it out by themselves and with family members. So there is so much about it that's, everything's underfunded. Just in the case of health care, we don't necessarily cover that like we might some other medical treatment. So there are health care challenges, there are housing challenges, and it is a problem that I think almost every family understands in some way, and the interrelationship between mental health and housing.
Of course, today was Mental Health Day in the Capitol, so we had a lot of people in kind of educating us about the system. One thing we're talking about in the Senate in terms of the bonding committee is crisis centers, is a place where people can be brought if they're having a incident or a meltdown, as opposed to a hospital or a jail, where there can be counselors that can deal with whatever their problem is. And then, yeah, well, I just say the other issue, and then we can go back to you, is the whole issue of children's mental health. And having school counselors that are trained to work with children or identify when there's a problem and then be able to help them, that's also really important.
We have a very serious shortage of mental health beds in this state.
Yes, right.
I hear examples all the time of patients that have been taken out of state because they have rooms in Wisconsin or the Dakotas to house these folks, which means we're spending a lot of extra funds. Right. Trying to take care of these folks in our hospital emergency wards or in our jails is inappropriate. But we also have a challenge of finding enough workers to man these mental health facilities. You can build a building, but if you don't have the staff to put into it to take care of the patients, you don't have much.
So the emergency centers that Senator Pappas was talking about, that is
crisis centers.
That is another positive addition. But if we don't build enough of them and of permanent supportive housing for after, these are short-term. There's 16 beds, and they're short-term, and I don't know if it's 60 or 90 days. But unless we have permanent supportive housing for them to go to, then they still are going to be discharging them to the street. So yeah, I just worry that it's going to be a false promise, and mostly it just means we need for a period of time to just be more aggressively investing. The housing infrastructure bonds are a very good tool. Virtually no other state has it, but what it allows us to do is partner with nonprofits, Lutheran Social Service, Catholic Charities, Common Bond, Beacon, Aon. They leverage $3 of private money for every $1 that the government puts in. They have to assure us that if we build this facility, that they'll provide all of the permanent supportive services. We know that model works. If you put the services that get them to a better place in life right there, you can stabilize a life, you can transform a life, and that's really our goal. We want them, at a certain point of stability.